From Rectangle Health, this is the Modern Practice Podcast, a show that provides you with fresh perspectives and practical advice from industry experts in the ever-changing world of healthcare technology. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast. We've got a great episode in store for you today on simplifying patient billing at your practice. Yes, it is possible, and joining us to share how is Ashley Bond, owner of Bond Dental Billing. Ashley, so glad you could join us today. Welcome to the show.
Thank you so much, Gary, for having me. I'm so glad to be here.
Pleasure's all mine, Ashley, and I want to start by giving our audience a chance to learn a little bit about you, because I think it'll all kind of set the stage for how Bond Dental Billing came to be. Can you tell me a little bit about how you got your start in the dental space?
Absolutely. So I started working for my father's practice. So he was a dentist in St. Louis, Missouri. When I was young, I didn't have a job at the time, and he was out a team member. So he told me I was going to work for him. So that's how I got into the dental space, but I fell in love with it really quickly and have never looked back. So I was his office manager, his insurance guru, his social media manager. I really just did a lot in his practice, but one of the main things I focused on was his billing. And then in 2015, I started staying at home with my daughter, and he dealt with a lot of turnover. So I would have to keep going back, help his practice, get it back on its feet, and then we would go through the same thing a few months later. So finally, I asked him if I could take over his billing from home, and that's how this company got started, Bond Dental Billing. So I started with my dad's practice, and now I get to help practices all over the country.
Were there a lot of issues with the billing that you uncovered as you took over that position in that role? And were they staff related, process related?
Definitely. So it was just a few months initially working for my dad's practice when the office manager left. So I was thrown into having to figure out a lot of the billing and a lot of what wasn't necessarily being done correctly. So I would say process is a big thing that was lacking in his practice. So we were able to get the processes up and running to be able to have an established team when I was there, and the team members that worked alongside me. And my dad taught us that really you want to become a master in all you do. So that's really what I went for. So yes, it was a kind of a combination of both staff and both process related issues we dealt with.
As you managed and really worked to fix the issues, I sort of see it happening. Was that the foundation of Bond Dental Billing?
So there's a lack of systems in place, and it was the consistency. So just not following through with the billing systems that we had. And that is the key to a successful billing department. And I would say the years that I worked for my father and now doing what I do with my own company, there are two buckets that I really see offices now fall into. And it's either that staff process issue or it's an overwhelm issue. So the practice might be running great, but it's running so great that they've maybe ran out of time to do those processes well. And a successful practice knows that doing billing is quite a process and it cannot be shortcut. It takes quite a bit of time. So that is really the foundation to getting started, and now how we get to help offices.
Were you connected with other office managers, in your area and other practice staff members going through sort of the same pain points you went through at your father's practice?
Definitely. So I thought in 2015, 2016 that it was hard to find quality team members. And I think since COVID, we found, it's even harder now. So the office managers and team members that are having the issues are dealing with that even more than ever. Finding quality team members to do their office billing and to do it well.
So tell me about Bond Dental Billing. How are you, your team helping, and what's that differentiating factor from others in the space?
Yeah, so there are, as many know, there's a lot of different remote billing companies out there, and I think it's for a good reason. I honestly think the future of dental billing will be remote billing. We see in medical, and dental typically always follows what medical is doing. So all the companies I think are needed. What I can tell you though, for us, I strive to treat all of our practices like it's my father's practice. So quality of care was most important to him in dentistry, and quality of service is what is really important to us. So will we be perfect? No, of course not. And if you find a company that says they'll be perfect, I would run, because nobody's perfect.
Absolutely.
But right. But will we be transparent? Yes. And will we be honest? Yes. And ultimately, will we treat you like family? That's my goal. So our quality of service is our top priority, like it was my dad's. And like I said, my dad really taught us to become a master at what we do. And that's what we've tried to do with Bond Dental Billing.
Words of wisdom from your dad, for sure. And you've grown so rapidly, and as you continue to grow, take on more and more dental practices, what sort of led you down the path of partnering with Rectangle Health and working with your solution consultant, Ryan Chambers?
So yeah, absolutely. And I have to give a shout out to Ryan. He has been such a blessing to our company, to our offices. Quality of service means the world to him, and it's so easy to see that. He really walks alongside all of our offices and is there to answer any questions that they have about their merchant or patient billing. So that to me means a lot. He treats our offices like we would, like family, and that's really important to us. But with Rectangle Health, so the neat thing is, outside of what typical insurance billing that's offered by remote billing companies, is we also offer that patient AR add-on service. So that's where we help offices not only collect from insurance, but also from their patients. So we are an extension of their team. So I tell offices, don't think of us as a hardball collection guys. That is not us. We
Sure.
take over what we call soft collections. So that would be just as if we were in the office attempting to do what they would do, collecting from the patients when their balances are overdue. We know office's reputation means everything, so we lead with that. And we get to use Rectangle for all of our patient AR offices. So I used it when I was in my father's practice, and it's neat that now I get to use it in our company. So it's a complimentary tool that we offer to collect balances from patients over the phone. The neat thing is you can set up payment plans really easily and vault credit cards for the patients. We use text to pay for the patients. A really neat tool is the online pay link. So if our offices come in, if they don't have a way for their patients to pay on their website or online, we help that get set up through Rectangle with them. And all the money that gets collected goes straight to the office. It's all a really low flat rate, and it really beats most of the competitors out there. So it has been crucial in the success of our patient AR add-on service.
Have your clients given you any feedback on those payment features that added value of that online link, the ability to capture payment through text, vault a card? What's sort of come back your way as far as the feedback?
Yes, so they love it. So just last week, so we had an office that just started our patient AR add-on service, and we sent out text to pay to, these are balances that were, I mean, up to a year old. And we sent out text to pay to all those balances. And that office collected in one day over $2,000 that had just been sitting on the books. The patients were waiting to pay. So they were happy to pay it. It was really just a quick text that they needed to kind of get that ball rolling. So the office was so happy. The patients were honestly happy to get that statement taken care of. They didn't even know they had a balance. And so it really works. And that is the cool thing to see, is it's just not another feature. It really works, and it's really easy to use. So it's a win-win for us, the patients, and the office.
Yeah, that's amazing. And it's almost like found money almost, right? Because you just,
Right.
it appears out of nowhere. And what we've found in so many conversations here on the podcast is the patients want to pay. They just need a convenient, modern way to do it rather than that paper statement getting lost in the, dining room table or wherever you keep your mail. That's really, really incredible to hear. Actually,
Absolutely. I can tell you, I have myself and I work in collections and collecting payments from patients from insurance companies. I think I have 2 bills on my counter as we speak because for me personally, I use online to pay my bills at home. So why wouldn't we have those solutions in dental? It only makes sense.
yeah, absolutely. We need to mirror the retail experience that we've all come to know, like the Amazons and Netflixes of the world. Before I ask the last question, I'm gonna drop a link in the episode description below so our listeners can learn more about you and Bond Dental Billing. I encourage you all to check out the website, learn more about Ashley. Based on your experience working in the practice, what's the best bit of advice you were given or give to manage and simplify billing?
Yeah, so I think what I would recommend is write it down and consistency. So we tend to overcomplicate billing, really, but there is a process for everything. It just needs to be written down, executed, and you need to be held accountable outside of just yourself. So for billing, I tell offices this could look like over 4 weeks in a month. Week 1, you just print your starting agent reports, your insurance agent reports, send statements, call on outstanding claims. Week 2, send statements, send letters to patients with balances over 60 days. Week 3, send statements, call on outstanding insurance claims. Week 4, send statements, call on those balances, patient balances over 60 days. And lastly, the end of the week, you print those same reports that you printed at the beginning of the month, review it with the doctor on what was done. So I think you don't have to make it difficult. Just write it down, write down your plan, be consistent, and then stay accountable to that plan.
Awesome, Ashley. Thank you so much and really great insight. And I have to thank you again so much for taking the time to join me today. And I hope we can have you on again real soon.
Thank you so much, Gary. It was really great to talk with you today.
My pleasure. And for our listeners, be sure to like, subscribe, and let us know how we're doing and what topics you'd like to hear discussed in the future on the Modern Practice Podcast. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.